Perfect. All right, if everyone wants to work your way down here, just pull up a seat. We'll go over the quiz and then we'll go over the lecture material. Sweet. All right. So the first one, it says your dentist notices decay on the mesial surface of your maxillary first molar. Describe the typical spread pattern of the decay.
An inverted triangle in the enamel, and then a regular triangle in the dentin for a slide.
Right. Yep. Exactly. So I have this little diagram here that we're going to go ahead. We'll just cover that now. So if we have a cavity starting right here in this fissure, it's just going to be just a regular triangle, right, to begin with. So we'll start to spread. And then does everybody know what this point right here is? Right, so this is the dentin right here, and this is the enamel. What is that point called where they meet? Yeah, the DEJ, so the dental enamel junction. Right, so right when it hits the DEJ, it's gonna shoot horizontally, kind of spread a little bit, and then I'll do like an inverted pyramid down here. So if I color this in, you can see how it spreads out once it hits that DEJ, right? While we're on the topic, what would happen if we got a cavity starting right here on the side of the tooth?
It's opposite, so it's inverted first.
Right. So yeah, so it's gonna start as like an inverted triangle here. You're right. And then what does it do once it hits the DEJ? Spreads like vertically, right? Yeah, laterally. So it'll do basically the same thing, but just kind of coming in from the side. So then we'll have another one that's bigger, just like that. Perfect. So when I had the exam, he asked me a question, and I think we just had to draw it. So I would definitely know those two. All right, so 1B says, which structure in the enamel counts for the spread pattern of the cavities?
The enamel rods.
The enamel rods. You guys know, we haven't talked about enamel rods yet, have we?
He just like said that. Pretty much the exact same wording, but the enamel rods and
The enamel rods.
Yeah.
So the enamel rods are the basic unit of the enamel. We'll learn about it more. But essentially, there are these little key-shaped guys like that. 3D, yeah. Little key-shaped guys that just kind of make up the enamel. So when you get the cavity, it just shoots right through there. Cool. So number 2, your dentist also notices that on tooth number 8, you have a cavity. He tells his assistant you need a DI. What classification of restoration would this be? So let's say class 4. Yep, that's right. For number 3, says a healthcare provider, you're asked to help identify bulimia, which is a disorder which involves patients binge eating and purging. How would we be able to see this? What type of structural loss would we be looking at? Erosion, right? It has all that stomach acid. So cool. Number 4, we're calling Engel's general classifications. Which classification would cause the patient to have the greatest amount of overjet? Right. Division 1, because that's when the anterior teeth are protruding instead of retruding, so they'd be out farther. Perfect. For 5, you're a forensic dentist investigating a murder, and you're tasked with identifying the age. The victim has a permanent first molars and central incisors, and the rest are primary teeth. What age would we think they're in? Right. Yeah, they'd be like right around 8ish, 9ish, right in between there. And then number 6, during breastfeeding, the flow rate of milk is regulated by which process? It's the elongation of the nipple, which is caused by the baby suckling and creating that suction with his mouth. So, perfect, okay,
For
cool.
that, would you want like elongation of the nipple or something? Do you know what you,
I think it would probably be best to say elongation of the nipple
Okay.
by like baby sucking. Just because like in the book it says the baby uses its tongue to press the nipple up against its hard palate, and then that is what elongates the nipple, allows the milk to flow. I don't know how in depth. Did he ask you questions about that last year?
Not really, just know it's the pressing, like the tongue is a big deal for musculature. So the tongue pressing up on the hard palate, that changes the shape of the nipple and that changes the flow.
Thanks, Jesse. Okay, cool. Do we have any questions? Quiz? Pretty straightforward. Okay, cool. So next we'll go, we already kind of did decay and cavities. Essentially you just kind of need to know if you have a decay starting on the top of the tooth versus the side of the crown, how that's going to go through, and then it travels through the enamel rods. Does anyone know what like the subunit it travels through in the dentin is called? Yeah, the dentinal tubules. We'll get into that more later. There's a couple more of the dentin that we'll talk about. Okay, so for restoration classes, who can tell me what the class 1 restoration involves?
on surface, on anterior or posterior cheeks?
Yep, so it's just a singular surface. And then it's usually like the occlusal or incisal surface, just on any tooth. So anterior and posterior tooth. What about a class 2? Right. So yeah, so this it would be on the posterior teeth. So posterior only. And then it's 2 or more surfaces. Cool. Okay. And then for a class 3, what are we looking at?
Anterior interproximal.
Right, so who knows what the interproximal space is?
It's like the space where 2 teeth that you.
Yeah, where they're touching right there. So it would be just like, pretend that's a really nice lateral incisor. Here's your central incisor. So the interproximal space is that guy right in between there. So that is what the class 3 is. Interproximal on anterior only. Right. Okay, and then class 4, what do you think?
The incisal edge of an anterior tooth.
Right, perfect. It's like in the quiz, it's just gonna be the incisal edge. It could have just 2 surfaces, all like 3 surfaces, all 4 surfaces. It's just gonna be right here on that kind of top corner there. So incisal edge, anterior only. Okay, and then class 5. Right, yep, so it'll just be right there down on the cervical side of the tooth, so right by the gums. Yeah, cool. I mean, obviously, those are kind of straightforward, just to kind of get in your head, memorize them, but those I would say are pretty important to know. So, and then we can go into the loss of tooth structures. So there's 4 types that we went over. Let's just kind of shout out the names and then we can talk about which each one is. Erosion, good one.
Fraction.
Abfraction. Abrasion. As well. Yeah. And then what's the last one? Attrition. Okay, so for erosion, what's going to be the main cause of erosion on the teeth? acid, right? So with erosion, it's mostly kind of just through your diet, things that you're kind of eating. If you're eating a lot of acidic foods, drinking a lot of soda pop, it's gonna wear down your anatomy. What about abfraction?
When the tooth flexes.
Right. So it's gonna be a loss of tooth right at the cervical part of the tooth, which we'll talk about more kind of here, but as you said before, you have your gums and then your roots. And the cervical part of your tooth is like right kind of where your tooth meets the gum. So there's two different types, like shapes of loss that we see. Does anyone know what those are? Yep, there's a saucer shape and then there's a V shape. So the saucer and then V. And what causes the saucer shape? Compression, right? So that's just gonna be when the teeth are like pushing really hard on each other, right? There's just a lot of pressure. And then what about the V shape? Tension, right? What would tension be? Like how would the teeth be pushing against each other? Would it be like straight on full force?
Like from like chewing, so your teeth aren't hitting straight on.
Yeah, usually it's like they're not hitting straight on, and so then the tooth kind of starts to almost bend a little bit. So then that's where that comes in from the tension. Because one side is getting stretched out and the other side is just compacting in. So then it's gonna end up breaking out. So cool. And then what causes abrasion? But more specifically, what kind of mechanical forces? Unnatural ones, right? So it's gonna be like something hitting in the face, using your toothbrush, scrubbing too hard. That's gonna kind of be what it is. So eating something, you know, you're eating the Jolly Ranchers, super bad for your teeth. Cool. So unnatural. Okay, and then the last one is attrition. What is attrition? What's the cause of attrition?
Bruxism.
Right, bruxism. That's one of them. Specifically, it's like physiological wear and tear. So it's like just normal things that happen from your body. So you grind your teeth at night, you clench your teeth when you're stressed, stuff like that. So yeah, physiological. All right, bruxism. Everybody knows what bruxism is, right? Yeah, this is the name for grinding your teeth. Cool. Any questions? Comments? Cool. We'll move on to the next one, which is nomenclature. I know it has it in your books. Pretty nice and neat. But let's start with the anterior teeth. Let's kind of start, like these are gonna be your maxillary teeth. So let's start kind of from the top. How do we break down the root? Right, so you have one section, that's the apical, which the apex like is the very top end of the root, so that's why it's called the apical portion. And then there's 3 parts to it. What's the middle one called? Middle. Perfect. And then what's this one right here, right where you get the crown? Cervical, right? Does anyone know what this point right here is? Kind of where the crown meets the cementum of the.
Is it cervical again?
Well, it's similar to the DEJ. This is one single point, right? I don't know if he's talked about it yet. It's this cemento enamel junction. It's right where the enamel hits the cementum. All right, and then when we get to the crown, they break it down a little bit more into like a grid almost. So we have 3 sections going this way, And then 3 sections going this way. Right, so. Again, this one right here is kind of gonna be the whole, like, this is all cervical. It's because it's right in the cervical portion of the tooth. This one here in the middle again is the middle of the tooth, yeah. Gotta love that when it's easy like that. And then what about the end here? Inside, right. Okay, perfect. And then they divide it up into 3, kind of going across the front of the tooth. What are those gonna be? What's this side? Let's say midline is here, mesial, right? And then the middle, yeah. And then this side here is the distal, okay? Then if we're looking at the side of the tooth, and then we'll pretend like midline's that way, I guess it doesn't really matter. What are we gonna call this part that's right here up against the cheek? Labial, right? And then middle. And then what about this one that's facing the tongue? Perfect. Okay, and then for the for like posterior teeth, it's gonna basically be the same on the bottom. You're gonna have your apical, middle, and then your cervical portion here. I guess I didn't divide that very nice, but you know what I'm saying. Right. And then you have your middle again. But what do we call it when we reach the top here? Right. Perfect. And then same here, we'll pretend that the midline's still here. This part on this side. Mesial, middle, part on that side, away from the midline is distal. And if we're looking at it that way. What would we call it if it's facing the cheek? Buckle. And then the facing inward was tongue. Lingual, right? So it's kind of self-explanatory. Again, it's just so like if you're talking about a specific part of the tooth, it's easier to go ahead and say, oh, it's on the cervical, like the medial cervical part of the crown, whatever. They can be like, oh, it's gonna be right there, or sorry, this is something in there. It's just kind of knowing the difference between anterior and posterior teeth. Like the anterior, we have the incisal edge. The posterior, we have the occlusal edge, and then since the posterior is up against the cheeks, you call it buccal. Which I think technically you can say like facial as well, but just kind of depends on how, like who you work with, how you prefer to say it. So, any questions with nomenclature? Okay, cool. The next is going to be the angles classifications. So there's 3 of them, kind of 4, technically 3. The first off, how do we sorry, what are like the points of the teeth that help us to know the classification?
The mesobuccal crest from the mesobuccal development.
Yep, so it's gonna be the mesobuccal cusp of the, I think it's the first maxillary molar. So let's pretend you have all these teeth here, and then you have your first maxillary molar. This is terrible. Make sure your line drawings are better than mine. Yeah, cool. And it's trifurcated, cool, sweet. So, and then this is midline. So your mesial buccal cusp, which is gonna be sitting, I think it's gonna be like that, and then this guy right here. And then the bottom one is gonna be still your mandibular first molar, but it's gonna be the developmental groove on that here, which is like right here. So if they're like lined up perfectly, call that a class 1. It just overlaps perfect. What happens if the mandibular tooth is actually like distal? Let's say we move this back here. It's gonna be a class 2, right? And so then that guy is right here. all these teeth are gonna be shifted forward. Right, oh wait, sorry, these teeth are gonna be shifted back, and these teeth are gonna be shifted forward. What are we gonna have? Right, we're gonna have like an overbite, that's when their jaw is kind of really pushed back into their face. And then we have the two divisions, division one, it's the protruding, so it's when the teeth are kind of flared out. And then division two is when those anterior teeth are pushed in, and so they're like retreating back into the mouth. And then for a class 3, it's basically just gonna be the opposite of this, right? It's gonna be that the mandibular tooth lines up mesial to the mesial buccal cusp right there. So the groove is gonna be like right there. And then same how that's like opposite of the overbite, you're gonna have an underbite. So that's when you get the people whose jaws are kind of, you know. Yeah, any questions with that? So, cool. Yeah. Okay, perfect. Now we'll go into talking about the primary dentition, which is very important to know. I feel like a lot of my test questions on this broke down. There's quite a handful of them about the deciduous dentition characteristics that separate primary from permanent, and then also our like the timeline for eruption of the teeth. So we have a couple of good pointers that we can give you on how to try to remember those. So just to start off, what are some of the characteristics that make a like baby teeth different than permanent teeth? Right, so the crown size is going to be smaller, and it's like proportionate to like the whole tooth. The whole tooth is going to be smaller, but specifically the crown length is going to be a lot shorter than the primary. What's another characteristic? No root trunk. Right, they don't have any root trunks. So the like right here, this kind of cervical area where the kind of the root goes up to the crown, they don't have that. It's just like the roots are just poking right off of that thing. The roots, what about the else about the roots are also different about the primary teeth? They have a specific kind of shape to them almost. They're more like flared almost. So instead of coming kind of straight down, they're almost like they kind of come out and curve a little more. And they're also like a lot thinner than the permanent ones. Deciduous teeth are like super bright white and have super thin enamel. I mean, this whole kind of section of your book has like 9 different things. I would just kind of memorize those going forward. Josie was telling us earlier, you work with him or you shadow with him, with Dr. Mercy?
I shadowed Dr. Mercy all of last semester, like 5 hours a week, so.
And tell him what he asked you with that.
Oh, yeah, so there was like a patient sitting in the chair and it was this kid, and he was probably like 8 to like 11, I didn't know his age. And Dr. Mercy was like, Josie, like, take a look at his teeth and tell me his age. And I was like, because it's hard to look in the mouth and like know which tooth is primary and which one is permanent. And then also I was like trying to wrap my brain, like remembering which tooth like erupts when. And the kid was like staring at me like, so yeah, it was stressful, but now I know the tooth age is better. So I've been done.
Right. So if you're ever shadowing, you gotta be prepared. And ask you some weird questions. Usually they don't, they kind of just say, yeah, you can stand next time. Don't worry, you can breathe down their necks, whatever. Cool. So it lists 3 reasons in the book for like why primary teeth are important. So the first one is just that it's needed for proper jaw growth. I think we talked about in lecture 1, when you don't have any teeth on your jaw, it just like starts to deteriorate the bone. So it's good for jaw development. The next one, the next reason why it's super important is because it maintains a space for the permanent teeth to grow in. So there's like the space. Permanent teeth. And then the third reason why they're super important is because it helps, I mean, it's kind of the same almost with this one, but they help guide the adult teeth into the spot. So as you'll learn about this, I think in the embryology chapter, we go into like more detail on what happens during eruption. But essentially when the baby teeth are falling out, it's because the adult teeth comes in and is erupting behind it. It starts to dissolve the root. So it almost follows like a perfect path right up into the spot that it needs to be in. So if you lose a lot of teeth as a little kid, a lot of Sickers teeth, sometimes they'll put spacers in there to help it like maintain the space so that your teeth can go in straight. And then there's two spaces that are really important when it comes to this whole conversation of like guiding adult teeth, creating space. Does anyone know what they're called? Primate spaces, right? So we have one that's on the maxillary and one that's on the mandibular. And what is like the central landmark? The cuspid, right? The maxillary cuspid. So on the the cuspids. On the maxillary side, it's going to be mesial to the cuspid, right? So if we have our midline here, and then the central incisor, lateral incisor, and then you have your cuspid, molar, premolar, whatever. You're going to have that space right there, the primate space. Maxillary. Okay, and then on the bottom, oh wait, whoops, put that this time. Drew it backwards from the book. Gonna be mesial right there. So there's gonna be a space right there. And then on the mandibular, where is it gonna be to the cuspid relation? This one, right? Yeah. Gave you the answer. So sweet. Again, not good at drawing teeth. And what do those help with? Guiding the adult teeth, maintaining that space for your molars to come in. So sweet. All right, does anyone have any questions? Anything they want specifically covered? The next part is essentially just going over like the table for time of eruption of teeth. Do we want to start with the permanent dentition or the deciduous first? Permanent. Permanent, okay, cool. It's above it anyways. Okay, so what's the first tooth to grow in?
Central.
First. The central incisors, which one, top or bottom?
Bottom.
At the bottom, right? The mandibular central incisor is gonna be the first one. So an easy way to remember this is something that you can like draw on your note sheet if you go to take the exam. They allow a note sheet, right?
Yeah, when you take the exam, there's like pieces of paper that you can grab on your way in as like scrap paper.
Right. So this is like a good kind of chart that you can have memorized. Essentially, we're going to spell out main, but we're going to start right here with the point of the M. That's going to be your mandibular central incisor.
Start with the I.
Starts with the I?
Yeah, the 6 to 7 molars.
Oh.
It's first molars.
I guess, I mean, well, that's technically the first tooth that comes in, but we can also start. Huh?
And to do the first molars.
It is, okay. Perfect, so we'll start with the eye here, with their mandibular, and your maxillary first molar, and when do those come in? Right, it's like, 67 years. So essentially, like you can just put 8 dots on top, 8 dots on bottom for all the teeth, and then you can start drawing the eye. And that's like the first 6-7 years. And then we'll go back to the front. We'll start here. when does the mandibular central incisor grow? In 6 to 7 years, right? And then if you like go about it, you can draw an M here, so you'll go up. Do the maxillary central incisor, which is the next one to come in. Down to the lateral incisor, up again to the lateral incisor. Down, right? So that's kind of the order that follows. It makes an M. So the maxillary central incisors come in at what time? Right,
Right,
7 to 8.
yes.
So that comes in around 7 to 8 years. Then if you go down one, the mandibular is also 7 to 8 years. You go back up to the mandibular or maxillary lateral incisors, and those are what, 8 to 9, and then it goes down, and it's 10. Right, no, yeah, 9 to 10 right here. 9 to 10. So our friend, the maxillary cuspid, is gonna take a little while to grow in. So we'll skip him for now. And we'll start with our A. So our A is gonna be kind of a funky A. We're gonna start right here. We're gonna go up, straight over, down, and then back over here to our that cuspid. So it just makes sense anyways. So this guy, the mandibular cuspid, is going to come in from 9 to 10. Then we go up. Wait, sorry, that's not the mandibular cuspid. That is the first premolar. And the first premolar comes in from 10 to 12. The maxillary one comes in from 10 to 11. Next one is also 10 to 11, or sorry, 10 to 12. And then the mandibular second premolar is 11 to 12. And then what about our maxillary cuspid? Finally, we got to this guy here. 11 to 12, right? Perfect. And so that's missing one. Cool. So what's the last letter of main? Is an N. And instead of like doing it like we did our A, we're gonna do like a normal capital N. So we're gonna go up, down, up again. And then these are our second molars, and our third molars are wisdom teeth. So the second molar starts from 12 to 13. Both of them. And then the wisdom teeth they come in when?
17 to 22.
17 to 22. Yeah, so they have like the broadest range. So this is something that I definitely grew out in practice. It takes a lot of practice to memorize, just because, like, especially right here with the premolars, like this one comes in from 10 to 12, maxillary comes in from 10 to 11. I think on my exam, he just like legit had the chart that is in your book and exit filled out. So this is definitely something, I don't know how it was on the online exam, but definitely something that you should practice drawing out. There's also one that's for the primary dentition, but it kind of doesn't make as much sense. It's kind of just like, if you can memorize it, then cool. But we also have a like fun mnemonic that helps with this one. So for this one, it's just going to be A-N-I. And so you're going to do an A like you normally, like we did above, the N like we did above, and then the I. And it's all in order. So your central incisors are going to come in, and this is all months, this is all years, right? So adult teeth are all in years, but the permanent or the deciduous are all going to come in months. So the central incisor comes in at 6.5 to 8 months. Same for the top here. The lateral incisors come in at 7 to 9 months. The cuspids come in at 12, sorry, 16 to 21. The first molars come in 12 to 16. And then the second molars come in 21 to 30. If I remember right, like you do A and I, but then you draw that N backwards to follow like order. That makes sense. Because it's these teeth and those ones, and then you start there and go back, and then you're finished. That makes sense to you, and it's like similar to this. Great. Doesn't make quite as much sense as the main one does. These are your main teeth, adult teeth, I guess, like if that helps. But then we also have a mnemonic, which you'll find out is and it goes like this, goes cool, logs, fine, canine saliva. So, you know who came up with this, or?
Yeah, Jared came up with this, he was a TA last year, and I didn't understand at first, but his story is like. Cool logs find canine saliva, so like if a canine is like a cool log. It was found by the canine, which makes the canine like a dog salivate.
Right. Yeah.
So that's the story behind the mnemonic.
I was gonna say, it makes me think about, have you ever seen like the videos of the dog has like a stick that's like way too big to enter the door and it's like stuck? It's a cool log. You know, it's too big to be a stick. It's a cool log. And so it's all covered in the canine saliva. So the C on the first one, what do we think that stands for?
Central intro.
Central incisors, right? So your central, the L and logs, lateral. And then the F, first molar. Then the C, canine. Canine, that one's pretty easy. And then saliva is just gonna be your second molar. Right. So, as we talked about last week, deciduous teeth don't have premolars, have the molars. So, cool. Those are your hubs to learn those. I don't expect you to have them memorized tonight, but next week, yes. All right. We can practice it again if you need help. Okay, does anyone have any questions? I think that's all the material for the week. There is like a little bit more about breastfeeding and like infants with pacifiers. You could chime in if anything, but I think really the most important things to know, if you're looking for like a pacifier or a bottle, you want it to have the shape of nipple in action. I think that's like the key thing to know. Also, breastfeeding is good for babies because it helps them to develop their face muscles, so the musculature of their face. It's soothing to their babies, never dip a pacifier in something sweet, but never dip in anything. And then, yeah, like we talked about before, breastfeeding, it's the whole process is just the baby pushing its tongue up against the part of the along the nipple with milk flow. So, yeah.
So all of this stuff, is it just like extra information just for fun, or should we memorize this?
So, I don't necessarily remember a lot of that being tested, but I think it's super important to know for the next two chapters. The next two chapters, we're gonna go and talk about like anatomy of the teeth themselves. We'll start with the maxillary dentition, and then we'll go for teeth, and then we'll go to the mandibular teeth. So knowing these different landmarks are going to be kind of crucial for you to know, especially in lab when you're doing wax ups. And Dr. Mercy says, oh, hey, you know, maybe the lingual fossa on your central incisor needs to like isn't as apparent as it should be, or you know, there's like the marginal grooves that you're going to have to get down. So it's really like it helps to know, especially the cusp of carabelli. That one's going to be on like your first molars, maxillary first molar. So that's going to be something that like you're going to end up learning about in the next chapters. But if you can go ahead and memorize them now, that would help with that.
So it's gonna show up later.
Yeah, it'll show up later.
So it's
Maybe
gonna
not,
be
like,
focused
everyone.
on like this material first.
Mhm. Yeah, but I mean, next week you're gonna have to memorize these landmarks and
Yeah, probably.
So how is the exam structured?
how is the exam structured?
Yeah, is it all multiple choice or is it like mismatch and?
It's like the same, so the format that your quizzes are is the same format as his exams. So some questions will be like a photo and then he'll be like label these and he'll be like drop down. Or he likes to list two statements and say statement A is true, statement B is false. So like everything that you're seeing on the quizzes, where it's a mix of questions, that's how he does it on his exams, but I don't think he really ever does like type in short answers. You don't have to worry about that. So whatever, as long as you're used to the quiz format, that's how the exam format is. It's on Canvas in the testing center. It's like the same type of deal.
Yeah, I would say like there are quite a few of like the pictures in your textbook that you need to label. Also, like Josie said, there'll be like some questions from like the dental boards, and there'll be especially for like the landmarks on the teeth, it'll be like which teeth, or label all the teeth that have like this structure, and then it'll like have a list of the teeth, and you'll have to put like A, B, and C, but not D, all of them, only A, that kind of sort of thing. So yeah, just be prepared for those.
And we'll do an exam review the week before the exam, along with like the lecture review. And we'll just go back through and talk about the things to study and like study methods.
And people on YouTube or Zoom, if you could see the whiteboard. I know we erased some stuff, but you can pause it and take in all its glory. Cool. All right. Thanks for watching.
Can I take a picture of that?
Yeah. Where do I click?
Thank you.
Of course.